Thank you for joining me today. I'm Russ Curtis, Professor of Counseling. This will be for NCE prep or just a summary of cognitive behavioral therapies. Oftentimes, three are talked about, and we may be a little bit confused about how they differ between Albert Ellis, REBT, Aaron Beck's cognitive therapy, and then Meichenbaum stress inoculation training. So I just wanted to give you, in my opinion, and I'm boiling these down, all three of them. I'll talk a little bit more in detail about how they change. I'll probably do that in other videos. But if you were to boil any cognitive behavioral therapy down to its very essence, they're wanting people to pay attention to their thoughts. Because the thoughts, think of it a little bit like, hey, you pay attention to what you're eating, and you know if you eat a lot of junk for a long period of time, you're not going to feel good. And the same thing is if we constantly feed ourselves with negative self-limiting beliefs and thoughts, it's going to affect the way we think, feel, and behave. So if we boil those down, whether we're talking about REBT with Ellis or cognitive therapy with Beck or stress inoculation training with Meichenbaum, I think these five things are happening, that we're helping clients identify unproductive thoughts and behaviors. Of course, this is if the client wants it, okay? It's always stage of change, and if the client is wanting to take a look at this. But as a counselor with a trained ear, we're listening for self-limiting beliefs, and we will call those out for clients. So with challenging unproductive thoughts and behaviors, this is an invitation. This is not a confrontation, but it's like, hey, you keep telling me that you're not worthwhile, or that relationships never work out for you. And where's the proof in that? How might we look at this differently? Does that mean, if that's been your case up to this point, does that mean that's going to happen throughout the rest of your life? And if the client says yes, say, well, how do we know that? Okay. And it can be kind of fun. There can be some humor involved. We're wanting to help clients recognize that our thoughts do affect us, and we get to choose our thoughts, okay? I mean, there may not be a lot in our life we can choose, but we can choose our thoughts. So, okay, we're helping client identify unproductive thoughts. Number two, we're inviting to challenge unproductive thoughts and consider restructuring them. Teaching coping skills. This could be breathing. This could be how to do cognitive restructuring. I've got videos on that. Then four is key here, folks. Nobody has ever gotten good at anything or changed anything in your life without practice. So just going to counseling once a week is not going to help identify and change self-limiting beliefs if you're not actually practicing that regularly. So whether this is a mindfulness practice every day, a gratitude practice, some cognitive restructuring every day, some mantras that you learn that really feel good to you. Maybe you're writing that on the bathroom mirror so you keep it fresh in your mind, or it's a sticky note on your computer screen. But practicing daily, just like you would for a sport or learning art or music or writing, you got to practice. And then taking small steps towards the goal. Okay, so small steps. This would be a big one, particularly for Meichenbaum, is that we need to learn the coping skills, practice coping skills, but then really move forward with that. What would that look like in terms of, whatever it might be, facing a fear or what have you? Okay, so this is what I consider just a summary of some of the three big cognitive behavioral therapies that are out there. I'm sure people will have different opinions about that, and that's certainly fine as well. Let me know your thoughts on this, and we'll talk to you on the next video. Take good care.